an intro music with visual of a healthy eye transitioning to a blurry, distorted image. Hello and welcome. Today, we're diving deep into a common eye condition called cystoid macular edema, or CME. This condition can affect your vision, causing blurriness and distortion. We'll explore what CME is, what causes it, how it's diagnosed, and what treatment options are available. So let's get started on understanding cystoid macular edema. A visual of various potential causes appearing on screen: post-cataract surgery, diabetes, uveitis, etc. So, what causes CME? The etiology or causes of cystoid macular edema are quite varied. One of the most common causes is following cataract surgery. Inflammation triggered by the surgery can sometimes lead to CME. However, CME can also be associated with a number of other conditions, including diabetes, particularly diabetic retinopathy, retinal vein occlusions, such as central retinal vein occlusion or branch retinal vein occlusion, uveitis, which is inflammation inside the eye, and certain medications, such as some glaucoma drops or rarely, niacin. In some cases, the cause may even be unknown, referred to as idiopathic CME. A visual animation illustrating the breakdown of the blood, retinal barrier, and fluid accumulation in the macula. Let's understand the pathophysiology. Basically, CME occurs when the blood-retinal barrier, which normally prevents fluid from leaking into the retina, breaks down. This breakdown allows fluid to accumulate in the macula, the central part of the retina responsible for sharp, detailed vision. This fluid collects in small cyst-like spaces, hence the name cystoid macular edema. The swelling and distortion of the macula disrupt its normal function, leading to the visual symptoms. A visual with statistics and demographics regarding CME. And now, about the epidemiology. Because CM can be linked to so many different conditions, it's difficult to get an exact number on how common it is overall. Post-cataract surgery CME, sometimes called Avine-Gas syndrome, can occur in a small percentage of patients. The prevalence of CME in individuals with diabetes, particularly those with diabetic retinopathy, is significantly higher. Understanding the risk factors and associated conditions is crucial for estimating an individual's risk of developing CME. A visual of examples of blurry, distorted vision simulating CME. What are the signs and symptoms of CME? The most common symptoms include blurred or decreased central vision. Straight lines may appear wavy or distorted, a condition called metamorphopsia. Some people also experience changes in color perception or have increased sensitivity to light. The severity of symptoms can vary depending on the amount of fluid accumulation in the macula and the underlying cause of the edema. A visual depicting diagnostic test: CT scan, fluorescein angiography. How is CME diagnosed? A comprehensive eye exam is the first step. Your ophthalmologist will use various techniques to examine your retina, including dilation. Optical coherence tomography, or OCT, is a crucial diagnostic tool. It uses light waves to create detailed cross-sectional images of the retina, allowing the doctor to visualize the fluid-filled cysts in the macula. Fluorescein angiography is another diagnostic test. A dye is injected into your bloodstream, and pictures of your retina are taken to identify areas of leakage and inflammation. A visual showing different classification scenarios such as post-cataract surgery or diabetic. While there aren't strict types of CME in the same way as some other diseases, we can classify CME based on its underlying cause. So, you might hear of post-cataract surgery CME, diabetic macular edema with CME, or CM secondary to uveitis. Classifying it based on the cause helps guide the treatment approach. A visual of various treatment options: eye drops, injections, laser therapy, surgery. What are the treatment options for CME? The goal of treatment is to reduce the fluid accumulation in the macula and improve vision. Treatment strategies vary depending on the underlying cause. Common treatments include topical eye drops, such as nonsteroidal anti-inflammatory drugs or NSAIDs, and corticosteroids. Intravitreal injections, which are injections of medication directly into the eye, are often used. Common injectables include anti-VEGF medications, which block the growth of new blood vessels and reduce leakage, and corticosteroids. Laser therapy can also be used to seal off leaking blood vessels in some cases. In rare situations, surgery may be necessary. A visual emphasizing healthy lifestyle choices and regular eye exams. Is there anything you can do to prevent CME? While you can't prevent CME in all cases, especially when it's related to cataract surgery, managing underlying conditions like diabetes and uveitis can significantly reduce your risk. Regular comprehensive eye exams are also crucial, allowing your doctor to detect CME early and start treatment before significant vision loss occurs. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, is also beneficial for overall eye health. A visual showing potential outcomes and ongoing research. What's the prognosis for CME? The prognosis for CME varies depending on the underlying cause, the severity of the edema, and how early treatment is initiated. Some people with CME may experience significant improvement in their vision with treatment, while others may have persistent vision loss. Early detection and prompt treatment are key to maximizing visual outcomes. There's also ongoing research to develop new and more effective treatments for CME. Researchers are exploring new medications, drug delivery methods, and surgical techniques to improve the long-term outcomes for individuals with this condition. Outro music and screen with information about scheduling eye exam. Thank you for joining us on this journey to understand cystoid macular edema. Remember, if you're experiencing any changes in your vision, it's important to see your eye doctor for a comprehensive eye exam. Early detection and treatment are crucial for preserving your vision.